Today I will be teaching you guys the symptoms and treatment of this problem called fibroid. More than 100,000 cases of fibroid is being recorded per year in Nigeria. The cause of fibroids isn't well understood. Risk factors include a family history of fibroid, obesity, or early onset of puberty. Symptoms include heavy menstrual bleeding, prolonged periods, and pelvic pain. In some cases, there are no symptoms. People may experience pain areas both in the abdomen, lower back, or pelvis. Sometimes, menstrual problems like abnormal menstruation, heavy menstruation, irregular menstruation, painful menstruation, or spotting. Also common, abdominal distension or leg cramps. A myomectomy can be performed through any open incision or in some cases laparoscopically. Most experts believe that about 9 to 10 centimeters, which is about 4 inches diameter, is the largest size fibroid that should be removed laparoscopically. Then what is this fibroid? You can also call it uterine fibroids. Uterine fibroids, also known as uterine liomases or fibroids, are being benign smooth muscle tumors of the uterus. Most women have no symptoms, while others may have painful or heavy periods. If large enough, they may push on the bladder, causing a frequent need to urinate. They may also cause pain during sex or lower back pain. A woman can have one uterine fibroid or many. Occasionally, fibroids may make it difficult to become pregnant, although this is uncommon. Or later reproductive years. Or eating red meat. Treatment, medications is allowed. Surgery, uterine artery embolization. Some medications can be administered to a fibroid patient like ibuprofen, paracetamol, iron supplements, gonadotropin, releasing hormone agonists. The exact cause of uterine fibroids is unclear. However, fibroids run in families and appear to be partly determined by hormone levels. Risk factors include obesity and eating red meat. Diagnosis can be performed by pelvic examination or medical imaging. Treatment is typically not needed if there are no symptoms. NSAIDs such as ibuprofen may help with pain and bleeding, while paracetamol may help with pain also. Iron supplements may be needed in those with heavy periods. Medications of the gonadotropin, releasing hormone agonists, may decrease the size of the fibroids but are expensive and associated with side effects. Don't get me wrong, if greater symptoms are present, surgery to remove the fibroid or uterus may help. Uterus artery embolization may also help. Cancerous versions of fibroid are very rare and are known as leiomyomas. They cannot appear to develop from benign fibroids. About 20% to 80% of women develop fibroids by the age of 50. In 2013, it was estimated that 171 million women were affected worldwide. They are typically found during the middle and later reproductive years. After menopause, they usually decrease in size. In the United States, Uterine fibroids are a common reason for surgical removal of uterus. Some women with uterine fibroids do not have symptoms. Abdominal pain, anemia, or increased bleeding can indicate the presence of fibroids. There may also be pain during intercourse, depending on the location of the fibroid. During pregnancy, there may also be cause of miscarriage, bleeding, premature labor, or interference with the position of the fetus. A uterine fibroid can cause rectal pressure. The abdomen can grow larger, making the appearance of pregnancy. Some large fibroids can extend out through the cervix and vagina. While fibroids are common, they are not a typical cause for infertility, accounting for about 3% of reasons why a woman may not be able to have a child. The majority of women with uterine fibroids will have normal pregnancy outcomes. In cases of intercurrent uterine fibroids in infertility, a fibroid is typically located in a submuscular position, and it is thought that this location may interfere with the function of the lining and the ability of the embryo to implant. Diet can also help in regulating this problem called fibroid. Diet high in fruits and vegetables tends to lower the risk of developing fibroid. Fibers, vitamin A, C, and E, phytosteroids, carotenoids, meat, fish, and dairy products are of unclear effect. Normal dietary levels of vitamin D may reduce the risk of developing fibroid. Genetics. 50% of uterine fibroids demonstrate a genetic abnormality. Often, a translocation is found on some chromosomes. Fibroids are partly genetic. If the mother has fibroids, risk in the daughter is about 3 times higher than average. Black women have a 3 to 9 times increased chance of developing uterine fibroids than white women. Only a few specific genes or cytogenic deviations are associated with fibroids. 80 to 85% of fibroids have a mutation in the mediator complex subunit 2. Familial idiomata, along with cutaneous leiomyomata and renal cell cancer has been reported. This is associated with a mutation in the gene that produces the enzyme fumarate dihydratase located on the long arm of chromosome 1. Inheritance is autosomal dominant. Fibroids grossly appear as round, well circumscribed but not encapsulated, solid nodules that are white or tan and show worldly appearance in histological section. The size varies from microscopic lesions of considerable size. Typically, lesions the size of a grapefruit or bigger are felt by the patient herself through the abdominal wall. Growth and location are the main factors that determine if a fibroid leads to symptoms and problems. A small lesion can be symptomatic if located within the uterine cavity, while a large lesion on the outside of the uterus may be unnoticed. Different locations are classified as follows. 1. Intramural fibroids. These are located within the muscular wall of the uterus and are the most common type. Unless they are large, they may be asymptomatic. Intramural fibroid begins as small nodules in the muscular wall of the uterus. With time, intramural fibroids may expand inwards, causing distension and elongation of the uterine cavity. Secondly, subserosal fibroids. It is also located on the surface of the uterus. They can also grow outward from the surface and remain attached by a small piece of tissue, and they are called pedunculated fibroids. Another one is submucosal fibroids. These are located in the muscula beneath the endometrium of the uterus, and disturb the urinary cavity. Even small lesions in this location may lead to bleeding and infertility. A pedunculated lesion within the cavity is termed an intracavitary fibroid and can be passed through the cervix. Cervical fibroids, which are located in the wall of the cervix, which are the neck of the uterus. Rarely, fibroids are found in the supporting structure, round ligament, broad ligament, or uteroscaria ligament of the uterus that are also contain smooth muscle tissue. Fibroids may be single or multiple. Most fibroids start in the muscular wall of the uterus. With further growth, some lesions may develop towards the outside of the uterus or towards the internal cavity. Secondary changes that may develop within fibroids are hemorrhage, necrosis, calcification, and cystic changes. They tend to calcify after menopause. If the uterus contains too many to count, it is referred to as diffuse uterine leiomyomatosis. Extrauterine fibroids of uterine origin, metastatic fibroids. Fibroids of uterine origin located in other parts of the body, sometimes also called parasitic myomas, have been historically extremely rare, but are now diagnosed with increasing frequency. They may be related or identical to metastasizing glioma. They are in most cases still hormone dependent, but may cause life-threatening complications when they appear in distant organs. Some sources suggest that a substantial share of the cases may be late complication of surgery such as myomectomy or hysterectomy. Particularly, laparoscopy myomectomy using a musculator has been associated with an increased risk of this complication. Treatment. To control symptoms. Example, symptomatic measurement. Medication aimed at shrinking tumors, ultrasound fibroid destruction, myomectomy or radiofrequency ablation, hysterectomy, uterine artery embolization. In those who have symptoms, uterine artery embolization and surgical options have similar outcomes with respect to satisfaction. Medication. A number of medications may be used to control symptoms. NSAIDs can be used to reduce painful menstrual periods. Oral contraceptive pills. Levonorgestrel intraterran devices are effective in limiting menstrual blood flow and improving other symptoms. Side effects are typically few, as the levonorgestrel, which is a progestin, is released in low concentration locally, while most levonorgestrel IUD studies concentrated on treatment of women without fibroids, or few reported good results specifically for women with fibroids, including a substantial regression of fibroids. Cabergoline in a moderate and well-tolerated dose has been shown in 2 studies to shrink fibroid effectively. The mechanism of action responsible for how cabergoline shrinks fibroid is unclear. Danazole is an effective treatment to shrink fibroids and control symptoms. Its use is limited by unpleasant side effects. Mechanisms of action is thought to be anti-gastric effects. Recent experience indicates that safety and side effect profile can be improved by more caution dosing. Gonadotropin releasing hormone analogs cause temporary regression of fibroids by decreasing estrogen levels. Because of the limitations and side effects of this medication, it is rarely recommended other than for preoperative use to shrink the use of the fibroids and uterus before surgery. It is typically used for a maximum of 6 months or less because after longer use, they could cause osteoporosis and other typical postmenopausal complications. The main side effects are transient postmenopausal symptoms. Aromatase inhibitors have been used experimentally to reduce fibroids. The effect is believed to be due partially by lowering systemic estrogen and partially by inhibiting locally overexpressed aromatase in fibroid. However, fibroid growth has recurred after treatment was stopped. Experience from experimental aromatase inhibitor treatment of endometriosis indicates that aromatase inhibitors may be particularly useful in combination with a progestogenic ovulation inhibitor. Uterine artery embolization (UAE) is a non-invasive procedure that blocks blood flow to fibroids, causing them to shrink. Long-term outcomes with respect to how happy people are with the procedure are similar to that of surgery. There is tentative evidence that traditional surgery may result in better fertility. One review found that UAE doubles the future risk of miscarriage. UAE also appears to require more repeat procedures than if surgery was done initially. A person will usually recover from the procedure within a few days. The 2016 NICE National Institute of Clinical Excellency, the non-governmental public body that publishes guidelines in the use of health technologies and good clinical practice in the United Kingdom. Guidelines state that UAE or UFE can be offered to women with symptomatic fibroids, which is fibroid being unusual 30 mm in size. Women should be informed that UAE and mammectomy, the surgical removal of fibroids, may potentially allow them to retain their fertility. Laparotomic. A laparotomic mammectomy, also known as an open or abdominal mammectomy, is the most invasive surgical procedure to remove fibroids. The physician makes an incision in the abdominal wall and removes the fibroids from the uterus. Laparoscopic mammectomy has less pain and shorter time in hospital than open surgery. Hysterectomy. Hysterectomy was the classical method of treating fibroids, although it is now recommended only as last option. Fibroids are still the leading cause of hysterectomies in the US. Another procedure is called radiofrequency ablation. It is a minimally invasive treatment for fibroids. In this technique, the fibroid is shrunk by inserting a needle-like device into the fibroid through the abdomen and hitting it with radio frequency (RF) electrical energy to cause necrosis of cells. The treatment is a potential option for women who have fibroids, have completely childbearing, and want to avoid a hysterectomy. About 20% to 80% of women develop fibroids by the age of 50. In 2013, it was estimated that 171 million women were affected. They are typically found during the middle and later reproductive years. After menopause, they usually decrease in size. Surgery to remove uterine fibroids occur more frequently in women in higher social classes. Adolescents develop uterine fibroids much less frequently than older women. Up to 50% of women with uterine fibroids have no symptoms. The prevalence of uterine fibroids among teenagers is 0.4%. 80% of African American women will develop benign uterine fibroid tumors by their late 40s. According to National Institute of Environmental Health Sciences, African American women are 2 to 3 times more likely to get fibroid than Caucasian women. In African American women, fibroids seem to occur at a younger age, grow more quickly, and are more likely to cause symptoms. This leads to high rates of surgery for African Americans. Both myomectomy and hysterectomy increased risk of fibroid in African American cases, and this causes them to fare worse in vitro fertility treatment and raises their risk of premature birth and delivery by cesarean section. This information is here to help you take good care of your self, because your health is your wealth. You are welcome.